The views and opinions expressed in the following program do not necessarily reflect the policies and the position of Now You Know. The views and opinions expressed in the following program do not necessarily reflect the policies and the position of Now You Know.
Good evening and welcome to Viewpoint. Together with experts and newsmakers, we'll make sense of the week's biggest issues and stories. I'm Barnaby Lo in tonight's conversation.
A key decision maker, head of the government's Zero Hunger program, co-chairperson of the interagency task force that's been leading the country's COVID-19 pandemic response. Cabinet Secretary Karlo Nograles and his team of czars have advocated for what they say is a multi-sectoral approach in addressing the crisis to save both lives and livelihoods. But after a gradual reopening of the economy, the Philippines now has the worst coronavirus outbreak in Southeast Asia. The government heeded the medical community's call for a timeout. But many are asking, what's next?
And good evening once again to everyone watching us on Facebook. Welcome to Viewpoint. Tonight, joining us live via Skype is the co-chairperson of the IATF, also the head of the government's Zero Hunger program, Cabinet Secretary Karlo Nograles. Good evening, Secretary Nograles.
Ay, magandang gabi po sa inyo. Good evening, Barnaby. Magandang gabi sa lahat ng nanonood at nakikinig ngayon. Evening, everyone.
Yes, thank you so much for joining us on a Saturday. It's been a very busy week for you, so we really appreciate that you're here with us on a Saturday evening. Now, of course, madami tayong kailangan at pwedeng pag-usapan, Kabsek, ano? If you don't mind, I'm gonna go ahead and start, and I'll start with what's going on right now. Of course, we are on the 5th day of our MECQ, which is sort of a compromise of what our doctors groups asked for last weekend. Now, I know a couple of days ago you said hindi pa natin masabi kung ano yung pwedeng maging epekto nitong MECQ, kung if it will really work towards flattening the curve or not. Pero ngayon, 5th day na tayo, any indications na meron kang nakikitang progress or positive effect nitong MECQ?
Actually, even yung mga UP experts po natin are saying that the MECQ will really bring down the numbers, no? Slow down the numbers. Mm-hmm. So if anything, makikita natin na before masyadong mataas yung pagtaas ng mga infections natin per day. Now it has sort of stabilized, even though it's still day 5, but we'll see more and more of the effect ng MECQ as the days go along. Siguro, kasi kung ika-calculate mo yung incubation period ng virus dun sa mga na-infect, it's about 7 days, 7, 8, 9. So nagmamanifest yan usually 7, 8, 9th day, after the incubation period. So mas makikita mo yung effect niyan, as we go along towards the MECQ. If anything, lahat naman ng mga experts are saying that this timeout na hinihingi ng ating mga health workers will really translate to siguro slowing down the increase, or stabilizing the numbers of COVID infected. Yun ang hinihingi ng mga health workers natin, and it will allow us to catch up also in terms of everything, in terms of contact tracing, in terms of increasing our health capacities, and health workers din, the need for additional health workers who will man our our hospitals, and isolation and treatment centers.
Yeah, actually that's my next question, because the criticism of the last ECQ that we had, which was back in March and in April was that hindi na maximize yung ECQ na yon. That was the criticism. So what is it that you're going to do or that you are already doing differently this time para itong 2 weeks na ito ay ma-maximize at yun nga, like you said, ma-increase yung health system capacity and etc. etc.
I think it's unfair also to say na hindi na maximize yung ECQs that we've imposed early on. No, if you would recall, during that time in the early fight against COVID-19, yung health capacity natin was not ready to take in so many patients and so many people infected with COVID-19, which is the reason why nag-ECQ tayo para to limit the movements, limit the exposures, and allow us to catch up. So sa testing pa lang, di ba? From 1 testing center to 5 testing centers, now we're about 100, more than 100 testing centers na now. So it's unfair to say that we did not maximize the ECQ as far as testing is concerned. Pagdating sa isolation and treatment facilities, we did not have isolation and treatment facilities like we do now, no? Dun sa mga mega centers natin like Ninoy Aquino Stadium, PICC, etc., Clark, and other mega treatment and testing facilities, no, temporary facilities natin nandiyan. It also allowed us to increase also the capacity ng mga hospitals natin and bring and hire more health workers, hire more contact tracers. So we were able to use the ECQ and maximize it to its fullest extent in terms of increasing our health capacities, all in testing, in treatment, in tracing, and isolation, etc. No? So unfair naman to say that that was not maximized. No? Here, much of the same thing. No? Right now, we are increasing also, we're adding more facilities in Metro Manila because kailangan ng additional beds. No? We are pushing the hospitals to increase also their bed capacities. May kwento ka lang, yung bed capacities kasi natin sa private hospitals, ang ini-impose po natin sa private hospitals is anywhere between 20% to 30%. Ang gagamitin nilang allocation of beds for COVID patients. Not all private hospitals are complying with that. So we really need to push more of the private hospitals to increase their bed capacity or their bed space by 20 to 30%. Sa public hospitals, ganun din. Ang ating hinihingi is 30 to 50%. And not all public hospitals, even local hospitals, are complying with that 30% rule. Which is why, pag sinasabi na nafi-fill up na yung bed capacity, ang factor niyan is not just because dumadami ang pasyente, but also because hindi nag-comply dun sa 30% and 20% rule yung mga hospitals. So itong catch-up natin, this MECQ is being used to push more of our public and private hospitals to comply with that. Then the health workers then. Government is now increasing its hiring of health workers sa mga facilities natin. So right now, we're in a hiring process and increasing the health doctors and nurses na i-assign natin sa mga areas na kailangan.
Pwede ko bang himayin yung mga sinabi ninyo?
Sure.
If you don't mind. Yung kasi yung sa bed capacity, so mga nakakausap ko na mga doctors. My brother-in-law is also a frontliner sa private hospital. My sister is also a doctor, parang ang sinasabi nila sa akin is, okay, we can keep increasing the bed capacity, pero kung wala naman healthcare workers, parang wala ding kwenta yung increase sa bed capacity. And ngayon, yun yung nagiging problema. You can increase the bed capacity, pero wala naman healthcare workers.
Correct. That's why we're on a hiring mode. No, we've been in a hiring mode, hiring more healthcare workers to fill in the needs, especially sa Metro Manila and the neighboring provinces in Metro Manila, where most of the cases are.
Okay. Pero yung sa pag-hiring, Kabsec, the DOH a couple of weeks back said na nahihirapan sila na mag-hire. So now what they're doing is they're asking the doctors to the barrio to come to Metro Manila to help out here in Metro Manila. And then they're also asking healthcare workers in the provinces to come to Manila to substitute for our healthcare workers here. Now, there's criticism na bakit daw tatanggalin yung mga doctors to the barrio. Kailangan daw yung mga doctor dun sa mga remote places.
Yes.
So,
This is
so
only
parang
tempor.
iniikot lang daw yung, so kung may chest piece ka, parang iniikot mo lang daw yung mga healthcare workers mo, but you're not really adding healthcare workers, which is what is needed.
No, we are adding health workers. In fact, we're still hiring. There are still slots available and we're still actively hiring. Yung panawagan lang na yon ng Department of Health is just on a temporary basis to fill in the gaps while we're still doing the hiring. Kasi immediate yung need. And the health workers that were deployed was part of the deployment program ng Department of Health. So they were deployed in the provinces to fill in the gap ng needs ng mga health workers in the provinces that time. But we are now in a national health emergency where the need is the need is now in Metro Manila and neighboring areas. So much the same way, if the epicenter or the increase in the number of cases were in a different province, ganon din ang gagawin. The deployment will be in that different province. It just so happens that it's happening in Metro Manila and neighboring provinces. So the deployment will necessarily be here as a temporary measure. But we're still continuing to hire more health workers.
So what is the plan to attract more healthcare workers into this fight against COVID? Because it looks like the last few weeks parang yun nga, nahihirapan yung DOH to attract more healthcare workers into the healthcare workforce?
Nakikipag-usap naman tayo sa ating iba't ibang mga nasa iba't ibang mga medical societies, for instance, and schools, medical schools. So this is one way for us to get more of the doctors and even the nurses to come in. Meron din naman po tayong database ng mga those who've graduated from nursing and who are not practicing, and those who've actually taken the license to be doctors, and those who've taken the license to be nurses. So we have that database for that, and we're using our resources to contact them actively. And there's even proposals to even tap those who have completed med school but have not actually gotten the license yet. So meron din tayong program for them. We know where to assign them. Of course, they can fill in some of the gaps also. No? But syempre, we can delineate the tasks. Kasi syempre iba yung full-fledged doctor na pumasa ng board, ng board exam, from those that are still waiting the board or pre-board or have not yet passed the exam. Pero meron din kaming pwedeng task na or assignment na ibigay sa kanila.
I think ito yung naging suggestion ni Dr. Tony Liachon just this morning actually. How about yung suggestion o yung proposal ni President Duterte to use the police and military reservists to augment the workforce?
When the president makes a statement naman, that becomes government policy immediately. So, syempre, those that are in the whatever workforce, whatever government agency that can lend a hand, we can tap into them, whether it's the police or the military, doctors and nurses who are serving in the uniformed personnel. We're tapping them din to augment din the workforce necessary.
Okay. And I'm going to go back to mass testing and contact tracing because these two have been points of contention for so long. And you pointed out that nag-increase naman yung testing capacity natin, and now we've reached in fact we've reached 30,000. This is true naman, this is a fact, no? We've seen this in the data, pero hindi naman tayo everyday na nakaka-reach ng 30,000, pero more or less nasa 20 to 30,000, ano. Pero ang sinasabi nila is parang nagka-catch up lang tayo. This was the target back in April and May. So parang dapat siguro higitan pa natin yung 30,000 right
Yeah,
now.
marami pa naman ang laboratories that are pending. There are pending laboratories asking also for accreditation, and they're going through the process. So we've not stopped accrediting laboratories. So the number will just go higher. And also we're looking at a different test. No, it's the antigen test. So the antigen has its advantages also because the antigen testing will also speed up the turnaround time. No, in 30 minutes or an hour, you'll be able to know if you're positive. So no more waiting for 24, 36, or 72 hours or 48 hours for your test results, much like the sa PCR lab test. But with the antigen, and we're finalizing lang the protocols for that. But some antigen tests have already been given clearance, no, by the FDA. So some private clinics and laboratories have already begun using the antigen. So kami naman sa IATF, that's also one of the ways for us. So meron tayong antigen, then pag pumasa yan, then we have the RT-PCR, and we have the gene expert.
Pero iba ba yung, forgive me for my ignorance, and the antigen test and the rapid test that a lot of people have been using in the
Iba yun. Iba ang rapid test. Ang rapid test is antibody. So it will only detect the antibody if your body has you have developed the antibody against the COVID-19. Antigen detects COVID-19, not the antibody.
Okay. I'm asking this because, of course, rapid tests have been encouraged in the last couple of months. Pero our medical experts have also been saying that these are not accurate. And now they're saying that the widespread use of rapid tests may have contributed to the spread of coronavirus in the country. So is there a move now to totally ban rapid tests, or do you still see the usefulness of these rapid tests?
Yung rapid test naman, as far as IATF is concerned, we've always been consistent in saying it is not the gold standard. It is a test that you can use, but you have to have a confirmatory test, which is the lab-based, the swab test, no, sa lab. So nasa protocols rin naman natin itong sinasabi natin, itong rapid test kit. But we've always warned the public that it's not 100%, it's not as accurate as an RT-PCR test. And anyone who passes through a rapid test must still undergo the confirmatory test, which is the RT-PCR lab-based.
But do you agree that the use of rapid tests may have contributed to the spread of coronavirus? And if your answer is yes, then should we ban it altogether, just to be on the safer side?
Yung assessment na sinasabi na ganun, we don't have the data. We don't have enough data to say, no. It's speculative, no. It has its purposes. Actually, when the IATF was talking about the rapid test naman, ang real purpose na nakikita namin sa rapid test is just to confirm that you have developed the antibodies to be able for you to be cleared from COVID-19. So it wasn't really meant for it to be used to check whether or not you have COVID-19. The gold standard is really the swab. And then now, if we approve the antigen, then that can be another test that we can use. But yung rapid test, because nga it just detects antibodies, pag nag-IgG positive ka, ibig sabihin, you've recovered. So the real yung nakikita namin function ng rapid test kit is just for those who have been previously infected with COVID-19 to find out if they've already recovered from COVID-19. You can use the rapid test instead of using a swab test. Kasi yung swab test, we were conserving it, di ba? We were conserving the swab test because early on, limited yung stocks, nag-aagawan ang iba't ibang mga bansa. So, para to save up on those, the RT-PCR swab test, yung test ng rapid test will only tell us whether or not you have recovered. If, for instance, you're in a hospital and then we want to know if we can already discharge you from the hospital, gagamitin mo yung rapid test.
I see. Okay. So maybe there's a bit of confusion among those who use the rapid test, ano. I'm gonna go to yung contact tracing naman, ano. Sabi ng DOH, right now they've activated yung code, which is the Coordinated Operations to Defeat Epidemic. Ito yung they're going to work with the local health authorities and the local government to go house to house and look for the symptomatics and asymptomatics, if I'm not mistaken, as well. So parang ito yung contact tracing, no, Cabsec?
Yeah, it's one of the methods for us to enhance yung contact tracing efforts natin. But really, contact tracing is something that we have to share the responsibility with sa mga LGUs. Primarily because the LGUs are the ones on the ground. So contact tracing necessarily has to be something that the LGUs have to really help us with. And then according to our contact tracing czar, si Mayor Magalong, at si Secretary Anyo, because under sa DILG in contact tracing, we really need to hire more contact tracers and we really need to train them some more, and we really need to give them yung assignment na per contact tracer dapat may matatrace siyang mga 30 people.
Pero hindi ba masyadong
targets?
Hindi ba masyadong manual tong ginagawa nating contact tracing? Because in other countries, they're using apps, they're maximizing technology, QR codes, they're able to track people, where they're going, if they left their quarantine facility, So meron bang ganong, are we going that direction? Because parang very manual and on foot itong ginagawa nating contact tracing.
Yeah, in other countries naman, they use apps and technology to help them in contact tracing, and we have that also. No, we had the Stay Safe app, and then there are other private apps also, and there are other developers also who approached DOH also to enhance yung contact tracing efforts natin. So itong mga apps at technology na to will only help us detect the probable. But ultimately, you still need people on the ground. You still need actual contact tracers to contact and trace actual people. Yung apps is just a tool.
But I'm asking because I'm hearing from doctors as well na yung mga pasyente nila are not getting any calls from contact tracers. And I know this one person who is a bed spacer and then he tested positive for coronavirus pero walang tumawag sa kanya. And then of course he's a bed spacer, so madami sila dun sa room. And then his roommates, they continue to go to work kasi wala namang tumatawag sa kanila from the DOH. Would these be isolated examples, or how extensive is our contact tracing system now?
Meron tayong central database, and then from the central database ng mga sino yung mga na-infect ng mga COVID cases, then it is the information is given down to the LGUs. And the LGUs naman down to the barangay level kasi may BERTs yan barangay health emergency response teams per barangay. They're the ones who are supposed to do the contact tracing. So, I don't know. Siguro may mga anecdotal experiences siguro, but marami rin naman akong nakakausap na sila ay na-contact ng mga contact tracers. So maybe it's not a perfect system, no? Maybe you will have some anecdotes, I'll have some anecdotes, another person will have some different anecdotes and experience. But there's much needs to be done, no? And that much has already been said by Mayor Magalong himself. No, there's still a lot that has to be done as far as contact tracing efforts are concerned, and even Secretary Anyo has also said that. No, so there's a lot of room for improvement as far as contact tracing is concerned, and siguro in all of the different items, no, from testing to tracing to isolation to treatment, yung nakikita nating areas of improvement talaga is contact tracing. And contact tracing kasi really needs the involvement, no, the active involvement of the LGUs. At ito yung pabalik-balik din sinasabi ni Mayor Magalong. He is not satisfied with the way LGUs have been conducting contact tracing. So it's really down to the LGU level. So yung database, from the database, ibibigay yung names, ibibigay yung information dun sa LGU, then it's the LGU who is supposed to do the contact tracing.
Connected kasi yan no, Kabsek, yung contact tracing tsaka yung mass testing. Parang you can't really do mass testing without extensive contact tracing. But anyway, I'm gonna move on from that because you mentioned Secretary Anyo, and there is a burning question about the barriers motorcycle. Si Secretary Anyo, he stands by his position na kailangan talaga yung barriers na yon. Pero we have already engineers from the Philippine Society of Mechanical Engineers who are saying na there's no proof that those barriers will help stop the spread of coronavirus. And they were explaining na medyo mahirap i-explain for me because I'm not an engineer, pero they're saying daw na even with the barrier, the way the motorcycle moves, mag-circulate pa rin yung particles. So it's the barrier isn't going to be a guarantee or a non-guarantee.
We actually discussed this in the IATF, and that association of engineers, we are scheduling a dialogue with them.
Okay, so you're open naman to hearing their position.
Yes, of course.
Changing your position on this, yeah.
Alam mo, Barnaby, dito sa laban na ito, importante talaga yung whole of nation approach, right? It's not just government who's in this fight. No, we're in this fight together. So we really listen to valid points naman from different sectors of society, and rightly so, because it's just not a medical fight, di ba? The fight here is multi-sectoral and multi-dimensional. And that's the reason why the IATF is there, kasi it's not just a medical team, but it's made up of different offices and agencies with different mandates, kasi nga kailangan nga ng whole of society approach dito. So we're always willing to partner and listen with well-meaning groups and associations who have suggestions or some comments about what we're doing to make it easier and to make us more effective in this fight.
So speaking of suggestion, I'll go to the Zero Hunger program after this. But just speaking of suggestions, Dr. Tony Liachon had another suggestion this morning. Sabi niya, one time, big time na daw, MECQ for a month. Is this something that you would consider?
We alam mo, I can't speak for the entire IATF. No, I'm just one voice there. So what we do is that we run it by our technical working group on analytics. No, so meron tayong mathematical model at meron po tayong mga parameters and measurements that we look at. No, certain factors. We look at 5 factors. No. That we look at, and we run it by the model. And then through that mathematical, statistical model, we are able to determine yung trends, and then our health capacity, then our social, economic, and security factors. We take that all into consideration, and then they report to us. And then they give an advice, and then give us the options, And then we decide on it based on the metrics and the measurements that they show us. And then we advise the president, and the president makes the decision, the final decision.
So you're not closing your doors on that because ang dami nagsasabi na hindi nakakayanin ng economy.
That's why I said, kasama sa 5 factors, yung economic factor, social factor, even security factor nandyan eh. So meron kaming formula that we follow. And we'll just follow the formula as we have already agreed.
Okay.
And then we'll make the decision. Well, the president will make the decision. We'll make a recommendation.
Okay. So since you already mentioned the social factor, let's talk about the Zero Hunger program. It's already August, but July was the National Nutrition Month. So you're the head of the government's Zero Hunger program. How big of a problem is malnutrition and undernutrition in the country?
Well, if you go by the numbers pre-COVID, sinasabi doon yung stunted growth ng children from 0 to 5 years old, yung children under 5, 1/3 of our children are stunted, no? And stunted growth kasi is an indicator of the lack of the nutritional intake of the child, no? At merong long-term effects po yung stunting. So if a child is stunted, not taking the right nutritional intake, and if that happens to him between the age of 0 to 5, where rapid brain development occurs, then dehado na yung bata by that time, di ba? So may long-term effects yan in terms of yung cognitive ability niya, in terms of the frailness of his body, and magkaroon ng long-term effect yan sa school, yung performance niya sa school, then of course after school, or he or she might drop out of the school. So ito yung nakakabahala, and we are looking at that in terms of the problem of hidden hunger, which is undernourishment and but over and above that, meron pang hunger per se, no? Now, when the Zero Hunger Task Force was created last January, this was pre-COVID. And if you look at the numbers that we have, maganda naman in terms of hunger per se, because the families who've experienced hunger have been decreasing, no? So, ang titarget na lang sana namin, ko-concentrate sana namin while we'll sustain the gains in terms of the fight against hunger, we were gonna concentrate on hidden hunger, which is malnutrition, no?
Pero parang COVID reset all that, ano?
Yes, that's the problem. So that was our game plan, but right now na-reset nga because of COVID. We're now faced with a lot of problems. Like for instance, how are we gonna conduct now the school feeding program, which is a mandate, by the way, no? And the school feeding program is we've been quite successful in addressing wasting, no, and severely wasted school-aged children through our school feeding program, not just in the Department of Education, but also in the SWD daycare centers. So now the challenge is, without face-to-face classes, how would it look like now? We'll have to do house-to-house. Now, that's easier said than done. Also, because at least sa school environment, you cook the meal right there and then, tas ipapakain mo sa bata for 120 school feeding days, and we've seen the success rate of that, no, which was quite substantial. Now we're operating under different circumstances. We'll have to do house to house. So what kind of food basket are you gonna now deliver to the house? Then number two, how do you ensure that the food basket that you're delivering house to house will actually be eaten by the child himself or herself, diba? And how do you measure success right now? So this is something that we're also really coordinating, no, very closely with the other agencies.
Pero Kabsec, how nga? You asked that question. Kasi yung SAP, yung financial aid, parang ang tagal-tagal bago mabigay sa mga tao. So based on that, hindi ba parang this is another challenge, parang I don't want to say insurmountable challenge naman, ano, pero kung hindi maibigay yung financial aid, yung cash aid on time, medyo months late na, so how are you gonna do this, especially in the context of this pandemic?
Okay, so the guidelines are being finalized now, but basically what we want to happen is, ganun pa rin, it will be DepEd for the school children who will identify who the beneficiaries will be. And then for the daycare center kids naman, it will be DSWD who will identify. Then there would be a partnership, MOA or an agreement between DepEd and DSWD with the different LGUs in terms of the implementation of the actual delivery of the house-to-house delivery, sabihin natin, of these goodies. No? That the food basket cannot be the usual rice, noodles, instant noodles, and canned goods. So we're partnering now with DOST FNRI who've developed mga more nutritious products, no, like iron fortified rice instead of the regular rice. Yung noodles, pwede yung noodles but they're noodles made of squash, no. Then if you give naman yung dalata, may mga instant laing, instant pochero, and instant pinakbet ang DOST. So we'll be using these food products plus yung pinakabago nila, which is the enhanced Nutriban. So in the 70s, during the 70s time, there was a Nutriban that was distributed to kids. So we can utilize that also for this distribution. And then yung monitoring yan will be through the barangay health workers or the barangay nutrition scholars. So down to the barangay level ang monitoring yan. Tapos kami sa Interagency Task Force on Zero Hunger will also be exercising our oversight and monitoring mandate namin.
And there is money for this.
Yes.
Because the president kept saying that there's no more, the government doesn't have any more money.
Yeah, but the budget for this was not touched naman for COVID, no? Because we knew naman that it had, well, it's also an anti-COVID measure, no? If we keep the children healthy, then it's also one way for us to prevent them from getting sick, not just from COVID, but from other diseases or sickness as well. And then yung pinakabagong program na gusto naming talagang itulak at isulong, yung sa first 1,000 days of life. Kasi bago lang na pumasa yung batas ng first 1,000 days of life. But this is where the kids are most vulnerable. And this is where stunting, irreversible stunting can actually occur. So may pilot program ang National Nutrition Council. So much the same way, feeding program siya, but instead of 120 feeding days, it will be 90 feeding days kasi it's just a pilot. Hopefully, we can expand that later on. But yung magandang ginagawa natin, Barnaby, in a manner of hitting two birds with one stone, itong feeding program natin, we are linking it up with the farmers' organizations. So through our Enhanced Partnership Against Hunger and Poverty program, yung magsusupply ng lahat ng mga pangangailangan for the healthy food basket or food pack that will be giving to the beneficiaries will come from small farmers organizations. So directly from the Agrarian Reform Beneficiary Organizations or from the farmers organizations accredited under Department of Agriculture or the irrigator associations accredited by NIA. So that way, we'll also be helping the farmers in their livelihood. Gobyerno na yung bibili ng kanilang produkto, bibilhin mismo sa mga farmers organizations. That way, we can also help them increase their income.
Is this linked to the plant program that President Duterte mentioned in his SONA?
Yes. So plant program naman is one way for us to increase food productivity as well. And if you look at the indicators natin, no, sa GDP, no, agriculture was one of the, is parang yung silver lining na lang natin kasi sa agriculture lang tayo nakakita ng growth, no, in Q2. So that gives us even more inspiration to push more for agricultural productivity towards food security. And hopefully, because of more food production, it will also stabilize the price. No? And in this time of pandemic, it's important that the food remains affordable to our people.
Speaking of so affordability and money, no. Sorry, I'm just going to go back there because there are questions about how the billions that we have borrowed for the COVID-19 pandemic response has been used. Kasi yun nga, President Duterte has been saying na wala nang pera for yung para sa ayuda nga para sa mga tao dahil nga nag-MECQ tayo ulit. So, meron nga ba o wala tayong pera? Because billions yung inutang natin.
Well, ayoko ring pangunahan ng gagawin ng Kongreso, no? Because they're currently finalizing Bayanihan 2. And I'm hearing word that they might tweak it to include another distribution, no, for those that were affected by the NECQ, no. Whatever it is, kung ano man ang maging final version ng Kongreso, then government has to look for the funds for that. So whatever it is, no, so that Bayanihan 2 will spell out in no uncertain terms how we will be spending what sort of money also that Congress will be allocating. So number one, we have to wait kung ano yung magiging final version yan in terms of how much budget ang kinakailangan and ano yung components ng budget. And the executive will just have to find ways for us to be able to spend for the money that Congress is telling the executive to spend. So if it entails borrowing money, then we'll have to borrow money for it.
So in other words, you're saying not to take President Duterte literally na wala na tayong pera.
No, when
So-
he says wala na tayong pera, ibig po sabihin yan is hirap talaga. And totoo naman talaga, hirap na tayo sa pera. But if we need to borrow, we will borrow. Because ang importante naman dito, even if you borrow, if you spend it correctly, especially if you spend it on programs, activities, and projects that will redound to the benefit of the economy or that will help the Filipino people get back on their feet, then that's money well spent. No, but clearly, everybody knows na all countries hirap sa pera. Lahat ng bansa sa buong mundo hirap sa pera. Everybody's suffering because of this pandemic, and all economies are suffering. Collections are suffering, no? But ang maganda dito sa atin is ano naman, yung collections naman ng customs and collections naman ng taxes natin sa BIR, we're still continuing to collect naman money, no? But obviously the expenses are more than the collection. So that's why you need to borrow. And we put somehow a cap, no? We put a healthy cap on how much we are willing to borrow. And by the way, when we borrow, most of the borrowings are domestic also, ha. So domestic borrowings is also good for our local economy as well, no? So more ang bias natin is still towards domestic borrowings.
Okay.
So, and like I said, if you pour that money, whatever you borrow, into activities that would help the economy, like help micro, small, and medium enterprises, help industries, help Filipinos get back on their feet, then at the end of the day, it will redound to the benefit in the short, medium, and long term.
Kabsek, that's true. I will agree with you on that the whole world is suffering economically, you know. Pero there's also this criticism, and I promise this is my last question. I know we're out of time. We're so over the time.
Okay.
This is my last question because there's the criticism has been that parang ayaw natin magpatalo. Pagka lumalabas yung statement, for example, ni Secretary Harry Roque na no, we're number one because we have so much testing, and Indonesia might not be, finding their positive cases because they don't have as many tests as we were doing. When Secretary Anyo says, well, every country is dealing with a resurgence of COVID-19. So parang ang criticism ng mga tao is, why do we keep comparing like that? So the benchmark, kumbaga, is parang very low.
Well, I don't know, but sa akin, whatever the number is, no, whatever the numbers are, that is something we must deal with. So doesn't matter what anybody says, no, anybody can have their own opinions about certain things, but at the end of the day, we are faced with those numbers. And the more we accept those numbers, as reality, then the more we can address the problems. No? So there has to be an acceptance of the numbers. We address it. We do something about it. No. So ganon. That's really what it is. And I suppose the message really, I'd like to siguro say na I think it's, if you look at the numbers, I have to say na it's something that you and I and all of us together have to solve together. It cannot be that's your problem alone. Everyone has something to contribute in this fight. Even if pabalik-balik na naming sinasabi, wash your hands, stay at home if you can. If you leave home, wear a face mask. Right now, studies show it's better if you wear a face shield and combine that with social distancing and combine that with washing your hands and good hygiene and all of that. Lahat tayo may iambag dito, no? So, if I look at the numbers, then you have to look at the numbers as well. Everybody has to look at those numbers and accept those numbers as things that we, all of us, can change together. And it cannot just be his fault or her fault or that person's fault. It's something we can fix together.
All right. And on that note, thank you so much, Cabinet Secretary Karlo Nograles. Thank you so much for your time. Thank you so much to our viewers for joining us tonight. I wish we can discuss more, I have so many other questions I want to ask you, but really that's all the time that we have right now. So thank you so much. Thank you so much for your time. Thank you so much for joining us in this episode of Viewpoint. So for everyone else, do catch us live every Saturday at 6 p.m. on Now You Know PH's Facebook page. Again, my name is Barnaby Lo. This is Viewpoint. Now you know.